Hello, this is clinical reflection number 10. So today I had a good day. It was a chill day. It wasn't too much going on. We did get a new admission who came in for suicidal thoughts. So that was pretty interesting. So a little bit about that patient. He was a 45-year-old male. Yes, he came in for the suicidal thoughts, so he was Baker acted. Um, so he did have a history of like poly substance abuse. So he did like marijuana. I believe he did like heroin. So other types of drugs, and also alcohol abuse. He also drinks alcohol a lot. He said that whenever we did an assessment on him when he arrived, um, it was it was a seawall assessment, and also just a admission assessment. He did mention that he drinks at least about 30 Budweiser beers cans a day, and then he says that he has like a pen, a wheat pen that he uses um, every day to go to sleep, and then he said he smokes at least a cigarette, a box of cigarettes actually every day. So he does a lot, which led him to come in and have those suicidal thoughts. He said he is having suicidal thoughts, and he does have a plan. And he does want to go through with the plan. So the goal for him, basically, he did have to have a sitter with him at all times. He couldn't have been left alone. We had to make sure he just could not be left alone. We had to make sure, security was on our floor, just monitoring and walking around, actively checking in. All his belongings were with the security. So he was a really nice person. His alcohol level was 300, so pretty high for him. He did have to get um, administered medication for that, so he doesn't experience the withdrawal symptoms. So whenever he do experience the withdrawal symptoms, they won't be as exaggerated. But he did have tremors when he did come in. He experienced tremors. Another patient I felt was very interesting. A 51-year-old male. He came in for cellulitis of the left foot and also cellulitis of the right knee. He also has acute kidney injury, and he was hyponatremia, so low sodium, and then he was also dehydrated. So it was his birthday as well. His birthday was on the 19th. So I was, telling him a happy birthday and just, wish that he wasn't in the hospital on his birthday, but just comforting him on his special day. He does have a history of hypertension, hyperlipidemia, cardiac stents, diabetes as well. So we did have to give him insulin as well. He was administered some antibiotics to clear up the cellulitis. He did have a procedure that he was getting prepared for, but he couldn't tend to the procedure until the cellulitis was cleared. So he got clindamycin and ceftriaxone for the antibiotic. For him, we noticed that his IV that was already placed, it just basically wasn't flushing properly and it got swollen. So that was the issue. So we had to insert a new IV. I was able to I had the opportunity to insert the IV, and I got it on the first try for that patient. So that was very exciting for me. It was a very big deal. Um, the patient even complimented that I did everything correctly and smoothly, so I didn't like hurt him or anything. But it was important to change that IV because his arm was getting swollen, and we don't want to blow any veins or cause any further issues with him. So it's important to always investigate and look at the IV. Actively flush it because if not, it can get occluded and infiltrated and it might not properly work. So you may not be able to use it for meds. So that's what we had to do for him. So it was really fun doing the IV insertion. That was like the best part of today. Today was just a day just to monitor patients. Many patients were Q4 vitals, but it was just monitoring them, comforting them, and just getting them ready to be discharged. A few of them were they had orders to be discharged this morning, so we were preparing them to be discharged. Most likely the day shift will take care of that. But today was a great day. Thank you.